Hi there. My name is Janelle Breeze-Biagioni. I am the CEO of the Constable Gerald Breeze Center for Traumatic Life Losses. And one of our important initiatives is the Heads Together Think Tank, which is taking place. We have a website, www.headstogetherthinktank.com, and we have 4 virtual events starting in October to look at the intersections of mental health, addiction, and brain injury. And what would it look like if we were to develop a provincial service delivery plan so that people didn't fall through the cracks and were able to get the services that they need when they need it. So joining me today is Toni King. And Toni and I go back a little bit of a ways. It's been a few years ago that I was able to work with her in the professional realm. And then our charity asked Toni to come and share her story at our inaugural National Day of Collaboration 2 years ago. What was that like for you, Toni, to share your story?
It's so empowering for me to be able to say what happened to me. It's made it more real, more, I just can't explain it. It's so nice to be able to voice my opinions and to let people know that, yeah, we're brain injured, but we're not crazy,
Right.
so.
Yeah. And your presentation at the National Day of Collaboration was so inspiring that when it came to doing this initiative and this project, your name came to mind right away as one of the people that we wanted to have on board. Part of this is because the entire foundation, not only all the work that we're doing, but the think tanks, is that the lived experience is so important, and that we need to have advisors, basically, of family members and survivors of brain injury to share their story, to come on and talk about what's needed, not only for them, but for their peers as well, right?
Mhm.
So you've been on the committee for planning this, and then you'll also be on the panel discussion on October 20th, so on the Real People, Real Stories segment. What was it like for you in planning this event? Were there any kind of big ahas for you when you were planning, listening to other people, what might be of interest?
I think what really stood out for me was the fact that we are, and when I say we, I mean the brain injured, there's a lot of us out there. And to be able to connect virtually, unfortunately, we can't do it in real life, but virtually is wonderful. And I know that we have people all across the country, which is amazing to me. So, helping planning was it was a fantastic thing because we really got to hear other stories and other points of view. And hopefully we can get it all together and make it a really nice thing for our presentation.
Well, we're excited about it. So you were also involved in a peer-to-peer support team through the
Yes, I
Victoria
am.
Brain Injury Society.
Yes, I am.
Part of my concern is I feel, and it's just as my statement, that survivors of brain injury and their families have always had a voice, but they haven't always been heard. And I've been challenged on that. When people say, oh no, we always listen to our clients and our patients. Do you feel that we've moved to a place where survivors of brain injury and family members, that their voices will be heard first and taken into consideration?
Um, to be really honest with you, no, I don't believe that we've come there yet. We've gotten there yet. We're on our way, definitely. I remember early on in my injury that it was really hard to access help and to find people that would be able to help me. And yeah, and I kind of fell through the cracks. So that was really hard, and trying to figure out what I'm supposed to do and feeling so alone.
Right. So, and because I do know your story, you did
Hmm.
fall between the cracks,
Yes,
and it was a number of years before you received services.
yes.
What do you think would have been the difference for you had you received services earlier?
I definitely would have, it definitely would have helped, yes. Um, I was sitting on my couch and feeling so alone. Um, and if I had someone that had been there for me after my initial discharge from the hospital, I could have gotten things set up in my apartment. to be able to help me get through the day for my activities of daily living. I had to set all that up myself. I had to set up someone to help me with my finances. And that was really difficult. I mean, I've actually fallen through the cracks with that too, but that's another story. Just trying to navigate the system, actually, really. And that's the main thing. That's the important thing for someone, especially who's fresh out of the hospital and needs that help, to get someone in there to show them what they need to do. This is how you need to set things up, or this is how we suggest you set things up. But having someone to come in and help you, then it just seems like there was nobody out there at the time.
Mhm. And I know in your story that what happened, there was a lot of significant changes in your
Mhm.
life and lots of endings as well, and to come to find the new Toni and who
Yeah.
you are and what life is
Yeah.
going to be like. So in that, would you say that you experienced some mental health issues with maybe anxiety or depression?
Oh, definitely, definitely. I do have major depression and moderate anxiety. And the whole anxiety thing just finally kind of snapped for me recently. So yeah, I do definitely have the anxiety. I didn't think I did.
And did you find that, and maybe it's different now, but at the beginning or still today, that when you were seeking services, that people were able to provide you something in a holistic way that would address all of it? Or was it separated between brain injury, mental health?
Yeah, it was separated, definitely separated. And that's really hard for me, because I need something that's all together. I need to have, everything in one place, and someone that's going to be able to say, well, this is what you need for PWD. This is what you need for your ADLs. This is what you need for your finances. This is what I need someplace that's a one-stop shop, basically. That would
Mhm.
be really, really nice.
Well, and I know Mariah was your team lead for the
Yep.
committee for the
Yep.
planning, and that was one of the comments that was really profound for Mariah, she told me, was
Hmm.
you expressing that I had all these places that I had to be, and I had to learn how to ride the bus,
Hmm.
and then I had to go to this place, and then get on the bus again and go to this place,
Hmm.
and brain injury, fatigue,
Hmm.
exhaustion, confusion, all the
Hmm.
things that go along with it, trying to navigate new memory
Yes.
issues, right? That kind of
Yes.
thing. That it would have been memorized, that it was just so profound when you said that people didn't even think about what they were asking you to do in a day. They just sent you on this
Right.
road
Right.
down to
And it
places.
was at that time, it was, I could only do one thing at a time, one thing a day. And I'd go and I'd have to talk to somebody at the ministry, and and I'm out, I'm down, I'm done, because I can't think anymore. So it was very hard. Yes, it was very hard. So everything in one spot would be really, really nice.
Okay. So again, I don't want to give away your story because you're going to share
Mhm.
that on the 20th, but going forward, what's the message of hope that you want all survivors and family members, because you have a son, and what do you want families to know and survivors to know about the journey of brain injury?
It's a long, hard journey. I will not say that it isn't, because it is. Um, but if you give it some time, and when I say time, I mean probably years, but it gets better. It's never going to be the way it was, but you can make it any way you want, because you're starting over. You're really starting over. So you can make your life the way you want it.
Okay. And honestly, you're one of the most happiest people I've ever met.
Really, thank you.
Given all that you've been through, I mean, you're always happy, you're very upbeat and encouraging to other people. So I applaud you for the
Thank
work that
you.
you've done for yourself and moving life forward. So I just want to encourage people to go to headstogetherthinktank.com and register, because it's super easy. You register on the site, you become, you're a participant in all 4 of the events that begin on October the 20th. They're free to attend. When you get on the site, then you can join different communities. So if you're a survivor, you can join the survivor group, which is a private group. If you're a family member, you can join a family member group, private group again too, so that those, you know, individuals have a space to talk frankly about what they want to talk about. All of the other groups on there are public, and you can join those as well. So you can join the region where you live. If you're from the north, or you're from Vancouver Island or Vancouver, you can join those communities too to talk to people. And then you can participate in the discussions around the actual events that are happening. And we do have a community on there for people outside of British Columbia, because as we said, this is something that we want to take across the country. It's not only British Columbia that struggle with this, it is happening in other provinces too. So we want to have those conversations. So, you know, again, Toni, I can't thank you enough for being a part of our planning for these important events, but your contribution has been excellent. And you know, again, like Barb Butler and all the others that are coming with you, you are the superheroes, and we applaud you for, you know, stepping forward with us shoulder to shoulder to make a difference for people in British Columbia. Appreciate it.
Thank you so much for everything. Just being a part of this organization has just been fantastic, and I can't wait for the years to come. Thank you.
Great. Thanks, Toni.
Mhm.